The pandemic's toll etched across the face of Toronto nurse Iram Chogala.
Just in one shift, we had approximately 4 or 5 patients that had to be transferred to the ICU because they were COVID positive and they were severely short of breath. Nurses are very drained, they're tired, they're burnt out, they're stressed.
Ontario's Omicron surge, with its crushing staffing shortages, is leading some Ottawa hospitals to consider a desperate measure, asking COVID-positive staff, even those with symptoms, to work.
The alternative is having nobody. So, there's 2 bad paths forward, and you're just trying to take the least bad path.
Quebec announced a similar move last month, and in Alberta, COVID-positive essential workers like healthcare staff are also allowed on the job as hospitalizations across Canada continue a steep upward climb.
It's very disconcerting. We have rises in hospitalization that are truly exponential, more of the inpatient side than on the intensivist side, but still both are going up.
Across the country, in New Brunswick, hospitalizations are at a record high. The province is projecting infections will soar more than tenfold by the end of the month.
This will impact not only our healthcare system, but also other critical services, such as fire departments, police departments, power services, and so on.
To ease the pressure in Ontario, internationally trained nurses will now be allowed to work in overburdened hospitals and long-term care homes.
Absenteeism right now, I would say, is really the big strain on the system.
A strained system Chogala helps to hold up every day.
It is a real crisis. It's a harsh reality that people on the outside, they don't look in, but I can attest to that because this is what we see on a daily basis.
Okay, so Ellen, this plan in Ontario to bring foreign-trained nurses onto the job, what kind of relief can hospitals expect?
Well, Andrew, this decision is being welcomed by many in the nursing community because of just how much pressure nurses have been under. And it could have a pretty quick impact. As many as 300 nurses will likely be able to start working by the end of this week. That's according to Ontario Health, being sent to dozens of hospitals across the province in urgent need of support. And about 1,200 internationally trained nurses have expressed interest in this program overall so far.
Okay, thanks very much, Ellen.
You're welcome.